Please join me in welcoming Governor Wes Moore, the inaugural recipient of the American Nurses Foundation Health Equity Legacy Award.
Okay, stops and all, y'all. Thank you so much. Good morning. Good morning. Good morning. Yes, it is true. I now have a open availability for next Saturday for dinner. So if anyone is feeling I am so grateful for you. I appreciate the recognition, and I just first want to say that on behalf of all of our many nurses in the state of Maryland, I just want to say that I received this award on behalf of you, on behalf of your service, on behalf of your work, on behalf of everything that you do for each and every one of us. I am so proud to be the governor of a state that has so many remarkable nurses. And I am thankful to be in a place with such remarkable public servants like all of you. Angela, I want to say thank you for the remarks, but more importantly, thank you for the leadership. Thank you for the focus. Thank you for being unafraid. Because we need people right now who are unafraid.
Yes.
And receiving this and being here with you means everything to me, because I am very clear about the service that you all provide all of us. That when you have a chance to meet patients, it's not because they're having a great day. That oftentimes by the time you get a chance to meet somebody, they are in difficult times. That oftentimes you are meeting people when they might be having some of the greatest struggles of their life. That oftentimes your job is not just to make sure that you are healing, but consoling. That you're not just treating, but that you're also touching. That your job is not just to rebuild the body, but in many cases of the people who you're meeting, you're rebuilding their souls, their spirits, their hopefulness, and their optimism. That your job is not just to make sure you are caring for the individual patient, but oftentimes you become the person who their family members and their friends also are looking to for support, for guidance. That is a heavy weight. It's not lost to me that every single day when you all go to work, by definition, your hearts will be filled and your hearts will be broken. And you will get up the next morning and you'll do it again. And so on behalf of not just the 6.5 million Marylanders, but for everybody in our society, I salute you and I say thank you. So this award in many ways, it just serves as a reminder, right? It serves as a reminder that some of the bravest people that we have in our society, that they wear scrubs. This is a reminder that despite the fact that I know there's a lot of uncertainty and anxiety that people have about healthcare and the future of it, and making sure that it's not just accessible, but also making sure that it's affordable. That at a time when we are seeing how resources are strained and limited, and unfortunately, we have seen how politics has become a substitute for science. And ideology has gotten in the way of actually supporting people that we care for. I want to thank each and every one of you for standing on the wall. I want to thank each and every one of you for always making sure that we're going to fight for our people. And I want to say this, that at a moment right now when things can feel very fragile, that in Maryland, we don't just listen to our nurses, we will always lift our nurses as well. And the reality is that that should not be a statement that requires of us.
Right.
Because it should just be standard. That for our nurses, you all are the ones who are providing the care, you're providing the compassion, you're providing the clarity. And whether that clarity or the compassion comes from treating a person or just simply holding their hand and making sure that they know that regardless of what they are facing, they don't have to face it alone. That nurses too often hear their patients questioning how they're going to be able to afford groceries, while also trying to figure out how they can heal their bodies. And knowing that unfortunately for too many people, that feels like a choice. That you're forced to make hard decisions on every single shift, decisions that you shouldn't have to make. Like who's gonna get a bed? How to help and support a staff that's already stretched too thin. How to give excellent care in a system that oftentimes feels undated, and the truth is that it is oftentimes outdated. And so, in many ways, nurses, you all will feel the consequence of policies that we're seeing before anybody else. And we continue to ask you to show up and do the work. Last month, I had the honor of staying with doctors and nurses at the University of Maryland, Capital Regional Medical Center over in Prince George's County. And by the way, I love that y'all are here in DC. Y'all know Maryland is so close. And when I was talking to our nurses over in Prince George's County, you know, we had a conversation and they were telling us about some of these policies and the difficulty of it. They were telling us that some of these policies, particularly these policies that we're seeing coming out of Washington, that it's just making their jobs harder. And I hear them loud and clear. Because oftentimes they were saying that, we went from policy that was data-driven to now being policies where it almost feels like it's choose your own adventure. And how deeply unfair that is, not just to our nurses, but also how deeply unfair it is to our patients. And I told them that I heard them loud and clear. So this past year, I've introduced legislation inside of the state of Maryland that will decouple the state's vaccine authorization from the federal government's. Because I believe that our vaccine policy should be determined by science and not by internet conspiracy theories. And I believe that we should be giving families a choice. And that choice should not be restricted by how insurance companies are then going to cover the vaccines. And so in addition to decoupling off of the federal government schedule and saying that we are going to let science and data actually lead how Marylanders are going to be supported, we're also saying to our insurance companies that what is being pulled together and the choices that families are making about their own personal vaccine schedules is not something that the insurance companies can play around with. That we've got to make sure we're protecting our people. And when nurses told me down in Prince George's County that they felt like oftentimes they were being stretched thin, I heard them loud and clear. And so in the budget that we just proposed, you will see that in Maryland, we made a $164 million surge funding available to hospitals to flex staffing during this record respiratory illness process that we are seeing in the state of Maryland and Washington. Because we just believe that support for our patients starts with support for our nurses. You want to support patients? Make sure that our nurses are getting everything that they need so they can then do their jobs. We were told by our nurses in Prince George's County that the workforce pipeline was breaking. And unfortunately, we were watching too many people exiting and too few entering. I heard them loud and clear. So as a state, we acted. And so our administration has invested over $8.5 million to support nurse educators, faculty fellowships, and doctoral training to make sure they're strengthening the pipeline and getting the support that you need. We cannot address a shortage without also focusing on training up the next generation. Or in essence, as I learned in the military, you all need air cover. And we're going to provide you some air cover. But in this time, we know that we've got to listen to what our nurses are telling us. When we were hearing nurses talk about the shortages they were seeing out in rural communities, and how difficult it was for our families over in Western Maryland or the Eastern Shore to be able to get the supports that they need, knowing that it is completely unfair that if a person lives over the Eastern Shore, that they should have to travel an hour and a half just to get basic supports. Mm-hmm. That should not be the case. And so we listened. And in this past year, we secured $168 million in federal funding in the first year of a 5-year rural health transformation program to make sure that when we say leave no one behind, we mean that in the state of Maryland. Yes. This is funding for education, this is funding for training, this is funding for career development programs, and making sure that the priority is going to be on rural health and rural health care. And when nurses told us in Prince George's County that health equity should be a primary focus, we listened and we acted. And so in partnership with the Maryland Nurses Association, we made structural racism training a requirement for licensed health professionals inside of the state of Maryland. Because I don't need to tell anybody in this room, but bias in healthcare costs lives.
Yes.
And we've got to be honest about that. And it's not just something that I know because I serve as the governor of Maryland. It's not just something that I know because I really like data. It's something because it is very personal to me. Because my father died in front of me when I was 3 years old. He went to the hospital because he was complaining about his throat. And when he went to the hospital, my mother eventually went to the hospital and joined him. And my mother was asked questions like, is your husband prone to exaggeration? What they did not realize at that time was that my father wasn't exaggerating. He was suffering from something called acute epiglottitis. Swelling of the epiglottis, where the epiglottis that sits in all of our throats every time we breathe or we talk or we chew, it lift up and allow air. And acute epiglottitis, as you all know, essentially is when the epiglottis becomes so swollen that eventually it won't lift. So after my father was released from the hospital, hours later, he died in front of me. He died because we had a healthcare system that didn't see him. He died when he could have been saved. And so when I said and I came on board that we were going to focus on healthcare and health equity, it's not because it sounded good or because it polled high. It's because I never want another child to have to come through life and experience this, to know what this feels like. I never want another spouse to have to go through what my mother went through, where she unexpectedly became a widow with 3 children that she was now going to raise on her own. So when we talk about the fact that Black Marylanders are almost twice as likely as white Marylanders to die from avoidable causes, when we talk about the fact that Black Marylanders are almost twice as likely to be uninsured, I understand that we have to do more than just offer talking points. I understand what this means is we've got to be prepared to actually do the work. And to prepare to make sure that we can build a better society where those statistics do not have to become permanent. But statistics like those can become relative history. And I want to be your partner in the work on that. I'm committed to being your partner in the work on that. And we want to make sure that everybody in our society can be seen and supported. We want to make sure that when we talk about that in Maryland, we want to create pathways to work and wages and wealth, that the way you create pathways to work, wages, and wealth is health. Because without health, none of that matters. The old expression of a healthy person has many, many desires. A sick person has but one. We have to make sure that we are doing everything in our part to help the helpers, to help the ones who, no matter what that person looks like, no matter where they are from, no matter their family lineage, no matter their income, no matter their situation, we need to make sure that we are supporting those who will see that person as what they are, a gift from God who needs every form of support that they deserve and that God requires all of us to provide. But I'm telling you this, we are not going to rest during this moment. We can't. Because I am convinced that if we get this right and if we partner, sure that people can get the supports that they need. If we get this right and we understand that health is the pathway to everything that we hope for as a society, we are going to build a society that those who came before us hoped for. And we will build a society that those who come after us, that they deserve. I thank you for being our warriors. I thank you for being our fighters. I thank you for being the ones who are willing to sacrifice your own time and energy and family time and friends' time, because you know that there are people in our society who need you. I know that weight is heavy. I thank you for it though, because in this moment, history will not remember those who faded away. History will remember those who stood up. History will remember those who understood the assignment. History will remember those who truly left no one behind. And so I thank you, not just for the invitation and not just for this wonderful award that I will cherish, but I thank you for who you are, for the sacrifice that you make, for the sacrifice you will continue to make, and for continuing to build a society that every day is worth fighting for. So God bless you guys, and thank you so much for having me.